Hello everyone, and welcome. This presentation is brought to you by AZCare. Together, we'll explore the world of scientific publications, breaking down complex research into clear and meaningful insights. Welcome. Today we discuss how occupational therapists, or OTs, guide patients through healthcare. AZ, our AI agent, will explain patient navigation and OTs fit. AZ, what's this presentation about?
I'll explain how OTs work as patient navigators, covering what patient navigation is, our study, key findings, and future implications.
AZ, what are patient navigator programs and their purpose?
Patient navigator programs, or PNPs, help overcome healthcare access barriers. Patient navigators, or PNs, guide individuals for better health. Roles vary. OTs as PNs are under-researched, unlike other professionals.
AZ, why are occupational therapists qualified for patient navigator roles, and what was this study's goal?
OTs train in rehabilitation and functional assessment, focusing on factors impacting health access. Our study described OTs in PNPs and mapped their functions to the 2021 Canadian OT competencies. Before diving into the paper, let me introduce AZCare. Americans spend nearly 1 billion hours on hold each year. AZCare's HIPAA-compliant AI agent, AZ, saves time by booking appointments, resolving billing issues, and more.
We've covered OT's importance. Now, let's see how this valuable information was gathered through the study. How did your team conduct this review on OTs and PNPs?
We used a scoping review, searching databases like PsycInfo and MEDLINE. We included English research featuring OTs and PNPs. Data was analyzed and mapped to Canadian OT competencies.
Methods understood. Let's dive into discoveries. This section highlights study characteristics and patient navigator roles. What were the main study findings and program locations?
As shown in the PRI SMA flow diagram, only 10 articles on OTs and PNPs were found, highlighting a research gap. Most were North American. Many PNPs were in community settings, targeting specific groups like homeless individuals or stroke patients.
AZ, what common functions did PNs perform?
Key functions included advocacy, care coordination, and patient needs assessment. Others involved community engagement, education, psychosocial support, and reducing barriers. Role titles varied, without explicit definitions.
Now, let's see how patient navigator functions align with OT core competencies. How did patient navigator functions align with Canadian OT competencies?
5 out of 6 Canadian OT competencies were evident: communication, culture, excellence, responsibility, and engagement. Occupational therapy expertise was not explicitly aligned, lacking specific terminology.
This alignment is fascinating. Let's discuss the unique value OTs bring and their future in patient navigation. AZ, what unique benefits do OTs offer PNPs, and why are their skills under-recognized?
OTs bring client-centered skills and healthcare system knowledge. Their expertise in occupation and community reintegration is underutilized. OT-specific models offer holistic frameworks. This suggests their professional identity may not be fully understood.
AZ, what are the key recommendations and your final thoughts on OTs and patient navigation?
More research on OT-led PNPs is crucial. Further, OT education on patient navigation and advocacy are vital. OT's unique competencies can advance patient navigation. This review supports their greater participation. Thank you all so much for your time and attention today. I truly appreciate your interest and engagement throughout the presentation. I hope you found the discussion insightful and that it sparked some useful ideas or perspectives. I'd be happy to take any questions you might have or hear your thoughts and feedback.